when you think about the Affordable Care Act, you think about what did it do that was positive. And it did do some things that are positive. But when you look at healthcare, healthcare largely falls into 4 different buckets. It falls into cost, quality of care, outcomes, and accessibility. And what the Affordable Care Act did is deal with accessibility without addressing costs at all. And what we have to do is go back and look at this like a business person would look at anything and address costs first. And then make sure that the quality of care and the outcomes didn't change, and then we can deal with accessibility. Because once you give accessibility, largely on the government dole, and then passed on to the people, costs of course are going to go up. When you think about this, when the Affordable Care Act was going through Congress and the Senate, how many drug companies opposed it? None. How many hospitals opposed it? None. How many device makers opposed it? None. You're not really getting something done until the people that are benefiting financially most from the high cost of health care are opposing it. That's your first indicator. When these people start complaining, we're getting somewhere. So we've got to go back to the costs. And people, I've looked at the costs myself too. People always go to prescriptions first. And what we need to understand is, well, it is a problem with some bad players and actors. It's only 10% of the entire healthcare costs. We've got hospital stays and caregivers, doctors, are the biggest drivers in this. And we have a system where our doctors are incentivized to give us test after test. I have to ask myself, how did I ever get out of my teenage years without 3 MRIs? Because that's what happens these days. Anytime you go somewhere and you have a headache, you got an MRI, you got a CAT scan, you've got all kinds of tests, you've got, a hospital stay involved. And this is getting to be too much. And then there's the one thing that we don't want to talk about. The last 6 months of your life, you're spending well over 80% of your entire healthcare costs. And we have hospitals that are constantly ignoring end-of-life directives. They come to families at the lowest point in their life and say, should we ignore this directive? Well, it turns out when they ignore the directive and they bring this person back, they're probably brain dead in a lot of cases, or they're on a respirator, and for 6 months, they're not spending the last 6 months of their life on the Riviera. We need to respect family directives, if that's what they want. If that's not what they want, then of course, do everything you can. But to constantly go to them and change that is something that we have to change. The healthcare initiative has to be looked at as a whole. The entire cost structure is out of control. The for-profit method has been a problem.